Mock certification exam number 2, and this is going to be from 1 to 25. What is phlebotomy? Phlebotomy is the process of drawing blood. 2. Which of the following is not part of a phlebotomist's point of care job related duties? And the answer is performing a tracheostomy or tracheostomy. Phlebotomists do not perform tracheostomies. 3. All of the following are true about laboratory safety except you may store food in the phlebotomy refrigerator. So that's the correct. All of the following are true about laboratory safety except you may store that is not correct. But protect your feet from spills. Always will require personal protection equipment. That's correct. Number 4. Certification is evidence that what? That the phlebotomist has demonstrated proficiency in the area of blood drawing. 5. Quality assurance for a laboratory personnel includes all of the following except it includes specimen collection procedures, specimen transport processes, specimen processing policies. 6. Which of the following personal protection equipment must a phlebotomist use when performing a skin puncture or venipuncture? Okay, so which of the following personal protection equipment must a phlebotomist use when performing a skin puncture or venipuncture? Now, this say goggles, and that's not true. The answer is gloves. Gloves, not goggles. So this is wrong. It's gloves. 7. Employers must provide vaccination against blah free of charge, hepatitis B. 8. The quality of the test result depends on the time between collecting the specimen and analyzing the specimen. 9. The Clinical Laboratory Improvement Act of 1988 follows guidelines and standards set by CLSI. So CLIA actually follows guidelines set by CLSI. A specimen must be rejected by the laboratory if the tube was mislabeled, the blood is hemolyzed, the tube was not transported properly. 11. Blah is the most important first step in phlebotomy and other testing procedure. The answer is proper patient identification. 12. When an admitted patient is not wearing an ID band, the phlebotomist must not draw blood until nursing has placed an ID band on the patient. 13. How should the phlebotomist proceed if there is a language barrier with the patient? Use hand gestures to communicate. 14. The lavender top tubes contain what? EDTA. The yellow top tube contain what? SPS or ACD. Which of the following tube contains sodium fluoride and potassium oxalate? The gray top tube. 17. In which tube would a phlebotomist collect an erythrocyte sedimentation rate? A lavender top tube. Which of the following tube yields a serum specimen? Red top tube. 19. A blood donation given by a patient for use during his or her surgical procedure is called an autologous donation. Which of the following is false for blood culture collection? The answer is the culture must be collected in red and marble top tube, and a tourniquet is not used for blood culture collection. So that's false. So which is false? So the truth is the culture must be collected in red and marble top tube. The area must be prepped with iodine or another antibacterial agent before the draw. A tourniquet is not used for blood culture collection. Okay. So this is false. Don't listen to none of what I just said. Which of the following is false for blood culture collection? A tourniquet is used to help access the vein. So C, that's it. A tourniquet is not used for blood culture collection. D, it said the culture must be collected in a red and marble top tube, and we know that's false because we know culture is collected into yellow top tube. So this 20 don't make no sense. We know blood culture is collected in a yellow top tube. And we know, okay, so I'm just going to read the correct answer. Which of the following is true? I'm going to say true about a blood culture collection. Collection of a blood culture used special blood culture collection vials or yellow sterile tube. Require sterilization of the collections by using iodine or other antibacterial agent, and a tourniquet is used to help access the vein. So if this was on the test and say which of the following is false for blood collection, C said a tourniquet is not used. We know that's false because we know a tourniquet is used. So C and D is false. And A is false. So this one I'm going to talk to the teacher about this one. The question should have been which is true for blood collection. And the truth is the air must be prepped with iodine or another antibacterial agent before the draw. That's how it should have been. Now, 21. A heparinized needle and syringe are necessary in the collection of ABG. Cold agglutinin test must be maintained at a temperature of and this is A is wrong. We know that's wrong. It's not 37 degrees Fahrenheit. So this is wrong. The answer is 37 degrees Celsius. A specimen being tested for cold agglutinins must be kept at 37 degrees Celsius to prevent agglutination. Also, if a patient is known to have a cold agglutinin, the specimen must be collected in a pre-warmed tube and the tube kept at 37 degrees Celsius prior to testing to prevent problem with the instrument. 23. Specimens for which of the following tests must be kept chilled? It have ammonia, pyruvate, and lactic acid. And the answer is all is correct. Ammonia, pyruvate, and lactic acid tests require that the specimen be kept chilled in a slurry or ice from time of collection to testing. 24. Which of the following is not needed for routine phlebotomy procedure? And the answer is, say, sticker. So that's correct. Because you do require Gulf tourniquet and you do require alcohol. 25. The depth of a heel puncture cannot exceed what? 2.0 mm.